I know Delegate Wells has to go, so I'm going to stop rambling and turn over to her. We are so fortunate to have folks like Senator Carter and Delegate Wells joining us on this call and on this effort and willing to speak out on behalf of the most vulnerable population during the COVID pandemic. You have families and constituents who are grateful for you and your efforts. And with that, Delegate Wells, I'm going to kick it over to you because I know you have to jump off early.
Sure. Thank you so much, Keith. Also, thank you to the coalition for inviting me. I'm Delegate Melissa Wells. I represent the 40th District here in Baltimore. Also, I'm here today on behalf, in my capacity as the first vice chair of the Legislative Black Caucus of Maryland. And I just want to thank all of you for this incredible work that you're doing around making sure that our individuals that are in facilities that are incarcerated, as well as our employees that are working in the facilities, that they are staying safe and that we're being mindful of the best way to keep them all safe from this horrible and deadly virus. And so I think what I want to just share is that, like, why this is so important to the Black Caucus is because Maryland has the highest incarceration rate out of any state for Black people. And so we already know how much this disease is ravishing and, further laying bare the disparities that have affected the Black community. And because of for those reasons, we really need to make sure that we're looking at all options to make sure that we are keeping folks safe. The governor has, made some inroads in terms of at least acknowledging that there needs to be an approach to releasing some individuals that could benefit from release and already are primed for release. But we could also be being more intentional about really lifting up that there are a lot of comorbidities associated with this virus, especially around hypertension, heart disease, and diabetes. And we know that, unfortunately, our incarceration, our prisons don't have the best healthcare for individuals. And so I believe that there is really a large number of folks that are very susceptible to this. And we've seen in the numbers in terms of those that have been found positive. And so I think it's important that we continue to urge the governor to increase the number of individuals that could be released. And also it's important not only for the safety of those that are incarcerated, and it's also humane for those that are incarcerated, but also the safety of our employees. And I think the last thing I want to add is that 80% of individuals currently incarcerated in Maryland who are Black have terms of at least 10 years or more. And so we know that we also want to do all we can, since they may not be primed for release anytime soon. We don't want to increase their risk of exposure. We don't want to also increase the risk of spread. And so to the extent possible that we can allow folks to leave, to be on home detention, or who are already prepared for parole or close to their parole date, to allow them to leave, we really should be exploring it. And then also we need to make sure that we're prioritizing our prisons and our jails and our detention facilities for the vaccine. I have not heard that plan as of yet. I'm sure that we might hear more about that on today's briefing, but I definitely just so you know, just please know that you have the full support of myself and also of the Legislative Black Caucus to make sure that we address this issue that overwhelmingly is affecting Black Marylanders. So again, I thank you for your invitation. I thank you for your time, and I thank you for all of the advocacy that you are all doing to address this issue. Thank you.
Thank you so much, Delegate Wells. We are immensely grateful for your leadership and your efforts and your understanding of the issue and the broader issue around the racial disparities and the impact, how COVID, is just a double jeopardy for a lot of African Americans who are already, as you said, Maryland leads the country in racial disparities in the incarcerated population. Thank you so much, and we look forward to working and supporting you.